Hello, everyone, and welcome to the 2023 BC Digital Health Forum, inspired by Canada Health InfoWay's Digital Health Week. On the heels of the national celebration, we now get the opportunity to dive deep into the world of digital health here in British Columbia and explore the exciting possibilities at the intersection of healthcare and technology. Teams from across Provincial Health Services Authority, also known as PHSA, and the wider healthcare system across BC have come together to bring you a week of amazing events, both virtually and in person. Some of those teams you'll see on the slide here. It includes the PHSA Provincial Digital Health and Information Services Portfolio, BC Ministry of Health, the Women's Health Research Institute of BC Women's Hospital, BC Children's Hospital Research Institute, the BC Healthcare Information and Management Systems Society, or HIMSS, and we also have a couple of academic partners this year, the University of BC and the BC Institute of Technology. My name is Tina Costa, and I am one of the directors with the PHSA Office of Virtual Health. I have the honor of being your host today, and I'm also joined by a number of our talented planning committee members. These folks have been and will continue to do all sorts of amazing things behind the scenes. So keep your eyes out for their names if you need any support during the week. Some names you'll see and get familiar with are Cecilia, Amanda, Sonia, and Sarah. Throughout this week's forum, you'll have the opportunity to explore a variety of topics and engage with some of our province's brightest minds in the digital health space. This year's theme is Collaboration in Action, creating a digitally enabled learning health system it's bound to make our forum truly special. As you learn more from the experts who are pushing the boundaries of what is possible, we encourage you to network, to share your insights, and certainly to ask questions. We have a fantastic mix of students, patient and family partners, healthcare and technology experts, and many more joining us throughout the week. We have no doubt the discussions you'll have, the connections you'll make, and the knowledge you'll gain will shape the future of digital health in BC. To meaningfully ground our day, I would like to invite everyone gathered today through this virtual circle to take a moment to acknowledge with gratitude that we are joining together from many traditional, ancestral, and unceded territories of BC First Nations. May we all take pause to honor their connection to this land and their stewardship in caring for and nurturing these lands for all time. I am a white settler and an uninvited guest on these lands, and I'm joining today from the traditional, ancestral, and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh, nations colonially known as Vancouver. As we continue to discuss digital health advancements and innovations, let us reflect on the importance of acknowledging the traditional custodians of this land. May this acknowledgement serve as a reminder of our responsibility to work towards reconciliation and to foster respectful relationships with the Indigenous communities who call this land home. And lastly, let us give thanks for the opportunity to gather, to learn, to collaborate, and to provide care on these beautiful lands. Before we get right into presentations, there are just a few things I'd like to highlight so you can make the most of your participation. First off, we have a number of accessibility features enabled to support an inclusive environment, including both captioning and interpretation. You can find out more about these features in the chat coming up. Please, during the presentation, send presenters your questions using the Q&A icon in this main window, should be at the bottom of your screen. We'll also be gathering your overall feedback via a poll at the end of each session to help continue to elevate this year's events. And so we thank you in advance for your feedback. We have a number of opportunities for you to interact and to win prizes. That's right, we have contests throughout the week, which you can learn more about via the FeedLoop Go app. If you haven't had a chance to download it, recommend it now. As mentioned previously, we're proud to host a variety of sessions for you during this week-long celebration. We'll paste a link in the chat for you to explore more of the week's events, including some in-person events. And if for some reason you're not able to attend the sessions, don't worry, we have you covered. All of the presentations are being recorded and will be accessible following the event. To open the forum today, I would like to introduce Shannon Malovec, the Executive Vice-President of Provincial Digital Health and Information Services at PHSA. Shannon is a highly skilled informatics leader. She's passionate about transforming healthcare and experienced in strategic planning, portfolio and program management, and systems implementation. She offers thought leadership in healthcare and is seen as a trusted advisor for the successful implementation of health IT initiatives. Shannon is experienced in both the public and private sector in Canada and the United States. She has led the execution of major clinical IM and IT projects across large health authorities, as well as set up project management offices, developed provincial and organizational strategies, and established benefits evaluation frameworks to measure outcomes and transformation. Unfortunately, Shannon couldn't join us live, as by her bio, you can tell she's a busy woman. However, she certainly wanted to be with us today and wanted to extend her welcome. And so we will share a short video from Shannon.
Good morning, everyone. Welcome to our first ever BC Digital Health Forum. This event is an evolution of our PHSA Digital Health Week celebrations, inspired by the National Digital Health Week. The organizing team has lined up an amazing week of speakers, learning activities, and opportunities to interact with one another. This year, in addition to our online presentation series, we also have a great in-person day planned on Wednesday. If you can't join us in person on Wednesday, you can still join us online. My name is Shannon Malovec, and I'm the Executive Vice-President for Provincial Digital Health and Information Services, and it is an honor to open the forum. I'm very privileged to be calling in from the unceded territory of the Lekwungen-speaking peoples of the Esquimalt, Wasanich, and Songhees First Nations. I give thanks as an occupier on these beautiful lands and waters around me, and I encourage us all to lean into our commitment to truth and reconciliation, and with that be thoughtful on how digital and virtual health can support our Indigenous peoples and communities. This is going to be an exciting week. The agenda is jam-packed. There are so many great sessions planned where teams will be highlighting the incredible work that is happening in this space. As attendees, you will see just how digital and virtual health can enable innovative models of care and help transform our health system. Our theme this year is collaboration in action, from design thinking and research to AI, analytics, and policy. I am proud to say the way this event has come together really is a true demonstration of collaboration. Championed by our virtual health learning team, this event has grown to include not just teams from across PHSA, but also the Ministry of Health, BC Children's Hospital Research Institute, BC Women's Health Research Institute, the University of British Columbia, BCIT, and the BC HIMSS Association. To achieve the digital health strategy, we need to think and work across organizational boundaries, and this is a great opportunity to do just that. To ground us, I want to refresh everyone on our BC Digital Health Strategy produced last year. We are well on our journey of execution of this strategy, and there is still so much more to do. We have 4 key strategic provincial directions, and you'll likely hear about them throughout the week. Number 1 is around enhancing patient engagement in care. In doing this, we have an objective of making health information available to patients to support their care journey, and also want to support patients in interacting with health services in a more efficient way. This could look like booking appointments online in a consistent way, filling out forms from our house that we can track, or having a virtual care interaction. Secondly, we want to improve the provider experience. Here we know that the introduction of technology can be burdensome for clinicians, especially when some information is still being faxed or mailed. We have an objective to help address this burden and improve the provider experience when interacting with digital tools. The use of AI and how we apply it in a meaningful, supportive way can be thought of here. Thirdly, we want to establish a connected health system. Here, we want to ensure information is flowing electronically across our system. The importance of solutions that we're investing in here is very critical. The systems that we're investing in need to meet industry standards. They need to be able to connect with other systems, and they have to be 100% secure. In turn, having a connected health system helps us produce a comprehensive health record in an electronic fashion that then can be available to patients and to providers. And fourth, we want to enable the business enterprise. In this strategic objective, we want to ensure that we're supporting the broader health system with modernization and ensuring that we have data available to make informed decisions, such as understanding our HR situation to help address the HHR challenges that we're experiencing right now. I hope you'll see that a number of initiatives taking place today are helping us advance in these areas. Some of you may have participated in our National Digital Health Week of events last week, where you likely heard very similar themes from across the country. I encourage everyone to raise questions, raise comments, interact with one another as much as you can throughout the week. Digital and virtual is a broad community of trusted partnerships that need to work together to help us deliver in this space. Unique to this event is our close partnership with academic and research institutes. Supporting our academic institutions is how we grow our next generation of leaders. A strong workforce is absolutely necessary for us to achieve our aims that we've set out for in the BC Digital Health Strategy. We're really excited to see the poster competition back again this year. Amazing to have all of the students participating and presenting their work. We're really looking forward to seeing what you've got to share with us all. And coming up on Friday, there's a design thinking workshop co-sponsored by BC.HIS, the Ministry of Health, and BCIT. This is a separate registration, so if you haven't signed up yet, please check out the website. I want to thank our BC Digital Health Forum Organizing Committee for their vision and all of their hard work, our patient partners, our panelists, and all of you for participating in this celebration of digital health in BC. I hope you enjoy the event and the connections that you'll make this week as we hear from a diversity of perspectives, achievements, and learnings from across our province. Together, we can create a digitally enabled health system that is connected, equitable, and accessible. I wish you all a great week of learning and team building. Have fun.
Okay, with that, let's get started in an inspiring journey together. Let's uncover the innovations, tackle the challenges, and work collaboratively, as Shannon said, to build a healthier, more connected, and more equitable future for all of us. We do certainly hope you enjoy this week-long celebration. We look forward to seeing you throughout our events. Our next session coming up right away is our PHSA session, which you guys can navigate now by using the panel on the left-hand side of your feed loop screen, and we will see you all there very shortly.